what is the solution to this case. So I would like to share a small history of what had happened and why am I presenting this case. And at the end would need your feedback on what should be done. I'll go back a year. It was a patient that was referred to me, a place called Ranaghat. It's around 100 kilometers from the place where I practice. And the transit time was around, from bus, train, auto and everything, around one bus, 5 hours. So up down was around 10 hours. So, and the cost of travel, because the patient would always bring a companion with him, around up down was around 400 rupees. And the food expenses came to around 100 rupees for the whole travel. So for every time he came to me, the expenses that the patient would encounter, even if I did it for charity, was around 500 rupees. So I calculated what expenses he was making during my trips. Now, as we all feel proud of doing charity, this was referred to me. So I also felt that I need to do some charity to some social causes, as I tried to explain to Surya, you have some social responsibilities. Very, very poor, so said that I would be able to afford 3,000 rupees for this surgery. And it was a bilateral sling. It's been there since birth. It's a congenital ptosis presenting at this age. So I said I'll do something for the patient, and I directly asked him, what would you be able to afford? He said, I will manage 3,000. Okay, I said, fine, I'll do it for this amount itself. Now, at the expenses that I encountered was around 2,500 rupees. OT charges, the consumable, the suture material. So at the end, there was some amount of profit of around 500 rupees at the first surgery. So I was really proud that I had done a good job, and I was happy at that time. Now, the patient came back a few months later, 2 months later rather, with this type of ptosis. The right hand image is immediately after surgery. First 2 months later, I really didn't know what had happened, but somehow probably the sling, I had done a frontalis sling with a silicone band, and it had slipped from the tarsal plate. So I was a little surprised. Why did it happen to me? So I said, okay, let's try something. And I really couldn't charge the patient. And I did the surgery. The OT people gave it as a complimentary gesture, and the sling cost me around 1,500 rupees. At around next to 1.5 months, I was really proud that I had again done a good job, and I was relieved of the status at that moment. But this is not the end of the situation, mind you. 2 months later, he again comes back following the second surgery, and the sling is again out, the silicone band. You can see at the top. So again, a tough situation. This time I was shocked. Why again to me? So I said I'll give him an assurance, okay, go back, come back after 2 months or 15 days. I'll plan a surgery, thinking what to do or send it to somebody, my colleague like Santanuda, so that he can manage that case, and maybe requesting for a complimentary examination. Now, he comes back after 15 days with an even more serious problem. So in between time, I have been examining the patient every follow-up. Now, oh God, this is the situation that have landed up. When I was looking at my old photographs, this is what I had done. When the sling was out, in my OPD, I had put my finger unconsciously over the sling. So the sling got infected, and this is the situation. I am really frustrated. What should be done? again, should I remove the sling? Should I redo the sling? Should I go back to the square where we had come to the patient? Now the current status is the patient has been coming to me for almost 30 times. So he could have traveled from Kashmir to Kanyakumari by train if he, the whole year. He's been coming to me, running around in trains for almost half a month. He could have bought a television set and not paid me with the amount that he spent on his travels. And he could have come to a posh hotel and had his food like that. And I am at a loss, and I am also at a financial loss other than the mental anxiety and strain I am in. And I really don't know the ultimate solution of where the patient will land up after at certain time. I really pray that the patient doesn't come back to me, goes back to somebody else. Thank you.